So I'm Keith Malcolm. I'm former member of the Queen's Alexandra Royal Navy Nursing Service, known as Florence. Served for just shy of 15 years, and I currently work for Portsmouth Hospital's NHS Trust as their Armed Forces Covenant lead nurse, of which I was the first in the UK. I designed the role, created the role, and now there's 27, 28 and counting across the UK. So starting at the beginning, I guess I followed in my mum's footsteps. She was an enrolled nurse. Back then they were called state enrolled nurses. And I followed her footsteps and joined nursing as an enrolled nurse in Aberdeen. And we were the first mother and son family, if you like, in the School of Nursing in Aberdeen at the same time. So she was just finishing her training and I was just beginning. So it was quite strange having both mother and son in the school at the same time. And so I became an enrolled nurse and started then working in the operating theatres, which I felt was my calling. I loved theatres purely because I felt that in theatres, in the operating room, it doesn't matter what your background is, whether you're a staff nurse, enrolled nurse, it's based on, you all wear the same uniform and it's based on experience. So I felt an equal, I guess, and worked in theatres. And then at that point, wanted to develop and wanted to become a staff nurse. And to be totally honest, there wasn't the opportunity to do my bridging course, as it was called then, in the NHS. I tried hard and then thought about the military and went to the RAF first. Sorry, Navy Army, but went to the RAF first. And that didn't work out logistically because I was unaware that because I was a Scottish trained enrolled nurse that the RAF didn't do an appropriate conversion course. So that sort of chapter finished. And then shortly after, I thought, actually, I'll give this another bash. Went to the Royal Navy this time. And 2 weeks later, I was at HMS Raleigh to a point Plymouth doing my basic training. So it was a bit of a whirlwind, not much time to think about it. So went into the Royal Navy as a pre-qualified, so as an already qualified nurse and a member then of the Corps. And I was what we called a GUS rating. So my first deployment, my first base was Plymouth, Stonehouse Hospital, which I loved, absolutely loved Plymouth, loved the people, loved the area, loved the job. And then managed to get my conversion course to staff nurse with the Navy and got my first promotion to leading hand. So really, within the first 3 years of my Navy career, I got my conversion course, got my development I was desperately needing, and a promotion. So I got everything that I needed from the Navy in 3 years and was prepared to pay that back with a 22-year service. I just loved it that much. And then from there, working in Plymouth, I also volunteered in the, it was called the DDRC then. I don't know if it's still called the Diving Disease Research Centre at Fort Bovisan, but we were down there and I would be a chamber operator and dive tender for treating patients in hyperbaric chambers, which I found interesting. So I would do that as well as working on the wards in Plymouth. And then from there, Plymouth Hospital sadly closed. And I was the last rating to walk out of that hospital as they closed the gates behind me. And then I was drafted to Haslar. It was Royal Hospital Haslar at the time. And there is where I worked on my profession. So Plymouth for 18 months was more getting to know the Navy, and then moved to Haslar, where I then started my profession and my qualifications, if you like, and trying to specialise, which is where then I got back into theatres and been in theatres ever since. until recently. And then, of course, they closed Haslam. So then I moved to Queen Alexandra Hospital, where I've been ever since. And again, I love it. I make the best of whatever situation I'm in, and pulling that experience with me, the skills that I picked up in the military where I left as a petty officer. So during that 15 years in the Navy, I was on our medical facility afloat, the Argus, RFA Argus, where we were out at one point a couple of miles off the Iraqi coast, where I was a team leader of my theatre table. There was two of us, a chief in charge of one table and myself in charge of my team at another. And yeah, that was a learning curve, very steep learning curve. And but it was one that will stay with me, obviously, for a long, long time. And then when I came back from Iraq, etc., I just concentrated on my civilian role, because at the time we were permitted, although paid by the military, we were permitted to apply for civilian posts. So there wouldn't be any financial gain. This was, again, for development. So I applied and was successful in becoming a team leader in civvy speak, if you like, in theatres, but no financial gain. And it was great. And then sadly, due to an injury sustained in Iraq, a back injury, I was invalided out of the Navy. But because I was in a civilian post, it set me in good stead that basically I was already doing the job. He negotiated my salary, and I basically turned around and said, well, I'll give you 3 months free if you secure my job at the end of it, which is what we did, and was there for a very long time, clinical manager of theatres, team leader, theatres coordinator, and then left to become the manager of an ophthalmic unit, which was extremely challenging and thought-provoking on a daily basis, which sadly then led to, and I'm not shy about talking about it because we don't talk enough about mental health, but I had a nervous breakdown and was off for 5 months. And it was at that point when I was off with my nervous breakdown that we then discovered I've got PTSD from Iraq. So that then led to where I am now, where I was in a position where I thought that, you know, I was one of the lucky ones, that my mental health is very mild compared to some, but it got me to reflect and to think that there are a lot of people, a lot of former military that need support, and their families, but they don't know what that support looks like and how to access it. And then in healthcare, you know, we don't know what's available, so we don't know what to offer. And being in Portsmouth, being a naval dockyard, a military city, tri-service, this hospital has over 200 serving military that work in the hospital alongside our civilian counterparts. We're called joint hospital groups, of which is 5 in the country, and we're the largest. So we weren't doing anything really proactively for our military community. So I suggested that maybe, you know, we need to fill that gap, and I might be that right person to do it. So to cut a long story short, I created the model, created the role of the Armed Forces Covenant Lead Nurse, to make people aware of the military culture in a hospital setting, and do some general training, teaching, and also support our military community, not only who are patients of ours, but also our staff, and support them who are former military, who are on our workforce. So it's a great part of my job that I not only get to support patients and their families, but also staff as well. So it's fantastic, and it's very, very rewarding, actually. I don't even see this as a job. I see this as a duty. there's lots of similarities, there's lots of contrasts. Being a civilian nurse back in '93, working in theatres again, you know, working in theatres was a great environment where it's a bit of a Marmite moment. You either love it or hate it. I absolutely loved it. I knew I would. It's what brought me into nursing, seeing, you know, things on TV about operations. So it's what made me interested in wanting to be a nurse in the first place. So a theatre setting as well is very family orientated, if for those that understand, and it is very team driven as well, and everyone's an equal, you know, and that's what I loved about the theatre environment. And so moving from that environment then into the military, again, we're one of the lucky professions, if you like, that I joined the military already with a healthcare professional qualification. So all I had to learn, so once I passed out at basic training, I think we had about a 2-week acquaintancy sort of course that we had to go on, which basically just made us aware of the changes in policies, the changes in paperwork, how things are done slightly differently in the military to civilian life. So it was just that sort of housekeeping sort of things that were done differently, the paperwork, the documentation. That was the only difference, because nursing is nursing, whether it's in the battlefield, whether it's on a ship, whether it's in a hospital. Personal care, patient care, the environment, cleanliness, hygiene, health and safety, infection prevention, everything is the same. It's just all the other little bits that go around it, or the logistical things that are different. So moving from Civvy Street into the military was seamless, I suppose. It was no problem at all. And equally at the other end of my career, obviously with lots of lived and living experience and more qualifications, etc. Many more years the wiser. At the other end, again, it was seamless. You know, again, at that end of coming out of the NHS for healthcare as a military professional into a civilian role was, again, seamless. There's no difference whatsoever. And because we are working very, very closely as a team with our civilian counterparts, because back in the day when I joined the military, I worked in a military hospital. So all staff were military. Whereas now you're very, very closely working alongside your civilian counterparts. So it was even more seamless for a nursing professional to leave the military than it was back in '93 for me joining. So it was absolutely seamless. I was already doing the job. So basically in theatres, Friday, I was petty officer naval nurse, and Monday, I was team leader. And as I said, we were on the RFA Argus, Royal Fleet Auxiliary Ship Argus, where our medical facility afloat is still based. You have to think differently. And that's what the Navy, what the military trains you to do. You rehearse, you drill, you practice, so it becomes second nature. And there were lots of things that I think happened in a short space of time when we were out in Iraq that do make you reflect, do make you think, because remember, a lot of us had never been in that situation before. The last situation conflict would have been Falklands. And so there was a lot of nurses as well, although I've been on pretty much every exercise the Argus had been on in my lifetime in the military. I loved the ship. I knew where pretty much every nut and bolt was. It was great. I loved going to sea and going on the Argus. But when we actually got deployed, there were a lot of younger medical professionals on there. They'd never been on the ship before, had never been to sea. some were brand new, newly qualified nurses. So there was a lot going on, a lot mentally to take on board as well, because what a lot of people don't realise is that, yes, in an operating theatre environment, I've dealt with limbs, limb loss, etc., amputations and the like, from car accidents, boating accidents, etc. But it's totally different when you're in a conflict situation and you're looking at the exact same injury, but it's been caused by standing on an improvised explosive device, an IED, and it's quite strange. I can't put it into words really how just a simple thing is how that injury was caused, the mechanism of the injury can really change your frame of mind, your mentality around things. And right at the beginning, I had to say to the surgeon and the anaesthetist, I don't want to know what caused it. I just want to treat what I see in front of me, whether it be a limb missing, burns, shrapnel. I just want to treat what I see until I know from my own mental health that I can take on board what's caused this, because none of us have been in that situation before. We didn't know what to expect. So it didn't take long before I felt, yeah, okay, I feel comfortable with this now. And then I started to inquire. I wanted to know what caused it and get more involved with things. But there was, I think the main lesson learned for me as well was multitasking. I know I'm a man and I'm not supposed to be able to multitask, but in civilian life, you do one thing at a time. If you have what they would call polytrauma, so someone that's got more than one injury requiring more than one specialty, you would do one at a time. Whereas on the Argus, I had the same sort of working space as you would on a trolley in theatre, but I would have tray after tray after tray after tray stacked up in the same space of all the different specialties. And I remember one of the first cases that I did was requiring neuro instruments for brain surgery, shrapnel in the stomach, so I needed general instruments, a general tray. Then we had orthopedics, so we had bone fractures, and we had what we call it polytrauma, so multiple injuries. But I had all the consultants at the table all at the same time, working in their own little silo, and I had to try and keep track of every single one. We're all used to having multiple surgeons working, but not from different specialties simultaneously. So for me, that was the biggest learning curve for me, and I didn't know if I could cope. I've not done neurosurgery, brain surgery before, but when you're in that situation, common sense kicks in, your training kicks in, your professionalism kicks in, and I got on with it, and it was all a success. It all went extremely well, it went extremely smoothly, and afterwards you do reflect and you think, okay, I managed, I coped, I'm proud of myself, surgeons were happy, the patient survived, and we've done the best we could. And I felt that if I can cope with that, then I could cope with anything that was thrown at me. So for that to happen early on, and that was my first casualty. So I had a steep, really steep learning curve. But then I walked away knowing that if I can cope with that, then bring it on, I can cope with anything. So although lots of reflecting has happened in my career, but I think that time on the Argus, there was more done than I would like to remember. But it's made me the person I am. Some people say that, you know, I am who I am now because of my time in the military, but I like to think that I was best suited to the Navy because I was like this before, which is why I enjoyed it so much. You know, I do believe now that things happen for a reason, because if I had been given it in Civvy Street, if I had my conversion in the RAF, would I be where I am now? Would I have had the life experience that I have now? Although, you know, nobody wants to have mental health, but the route that I took and the life experience that I had with mental health as well has, you know, if none of that had happened, again, I wouldn't be where I am now. So, no, I'd never been to sea before. It was joining the Navy was purely professional. It was purely to get my conversion course, and I just didn't expect to love it as much as I did. But I was so grateful for them giving me what I wanted. I was prepared to give them 22 years back, and you know I would still be in now if I could. You know, I've got no. If you were to ask me if I could list all the positive things that the Navy have given me, we would be here all day. If you ask me about listing the negative things that the things I didn't enjoy in the Navy, then simply it would just be one, and that would be the day when what we would call P8'd. So P8 is when you get the signal to say you've been invalided out of the Navy. That was the saddest day because, and for 2 weeks after, I couldn't talk about it because I was grieving for something that I'd loved and now lost. So that was the only negative thing in my naval career, was losing being in the Navy. But there's so much opportunities in nursing and in the military, opportunities that you get to do things that your civilian counterparts would never get to do. You know, flying in Chinooks, going to different bases. I went to Slovenia, Slovakia, and Lithuania as a sort of an exchange program, and for a few months on their United States military ship United States Navy ship USNS Comfort, and it's a converted tanker. So it's a huge facility. So it's the Americans' equivalent of our medical facility afloat, but it's 10 times as big. And we went out to the Baltic state, and we got to visit, you know, some hospitals out there to see how their healthcare compares to ours. We even managed to walk through the gates of a nuclear base, a weapons base, where we were stood. It was very surreal that we were stood where you had all the cabinets with the gloves you put your hands in to handle all the nuclear components to make nuclear bombs in former Yugoslavia, and to know that people have probably died standing where we are, and here we are being escorted in to have a look around. So there's lots of experiences. When we had 1 day shore leave when we were out in Iraq, and I was fortunate enough to join my officer in charge of theatres, and I think it was the engineering officer of the ship, to have a cultural day, and he hired a car, and we went out and visited a few oases, even went to Job's tomb, where there's a footprint of Job from the Bible, and we were able to touch it, see it, go to a valley where they filmed part of Star Wars. It was a really unique experience that, again, a lot of people just won't get to see unless you're in the military. And I've got no negatives at all apart from the day I left. Actually, I'm thinking about it, with my back injury that I incurred. The injury incurred whilst I was in Iraq, but then as the process is, I went through physiotherapy for a long time and some rehab to see if we could rectify things that way, with no success to a degree. But I was made as fit as I possibly could be, and fit to go on exercises again, and deployments, etc. And we went on exercise to America, which was the first time we'd ever done that, and went to North Virginia, and it was through, I still can't, there's no injury or mechanism, but all of a sudden my back just went totally. I really, just to put one foot an inch in front of the other was so excruciatingly painful. It was unmanageable. There was at one point when we were shoreside in North Virginia that we were trying to get back to the ship, and I was in so much pain by the time we got to the sort of the main gate, if you like, of the US main gate of the dockyard, that one of the police actually offered to drive us to the gangway of the ship. So yeah, so I've been in the back of an American police car now as well. But it was strange being taken back to the ship and then being treated by my colleagues, my friends, as a patient. And, you know, it was nothing but total professionalism. I had nothing but respect for them. And they treated me the best they could. They couldn't get on top of the pain. And they tried to get one of the anaesthetists to use some local anaesthetic to sort of numb me from the waist down, sort of thing, to stop the pain. And she couldn't do it. And then the orthopedic, the bone doctor, the consultant came along and he said, "Oh, Keith, do you mind if I have a go?" And I thought, I don't really care. I'm in so much pain. Anybody can have a go. I don't care. And thankfully, he was able to do the job. And I was basically numb from the chest down, total relief that I was pain-free. And they said, "Right, get him off the ship right now." And my colleagues packed my bags for me. The Royal Marine Band that were on board as casualty bearers, as stretcher bearers, as they are in conflicts. They provided their role seamlessly. They were fantastic. And I was taken out to the helo, and the helicopter then took me to Bethesda Hospital. And from there, I was then taken to a nearby base the next morning, and the RAF were there to casualty evac, so a CAS evac, me from America on the back of a C-17 aircraft and fly me back to the UK, where they had an ambulance waiting for me that took me back to Haslar. And then 2 weeks later, I had my back surgery, urgent back surgery, and fixed. So I've been through the casualty side of things as well, being in the military, and it worked absolutely seamless. The consultant came back to me to say, "Oh, can we just check that the processes that they put on board in the ship," like, because we had scans and x-rays, etc., capability on the ship. So he wanted to make sure that the pathways, everything worked. And I managed to feed back to him and said, "Yeah, the hospital consultant got all the scans, x-rays, they all came through." So I was a bit of a test of the system and the integrity that it all works. And you know what, I've got no complaints whatsoever. It worked absolutely seamlessly. So it's good to know that all the components, when you're deployed, it does all come together. It does all work, from the CASEVAC, from the stretcher bearers to the nursing. It's just a first-class service, first-class team. I felt as if my time in the Navy was cut short prematurely. I felt that I still had so much more to offer, which is why I think leaving the military due to my back injury was harder for me, because I didn't want to leave and it was forced upon me when I had so much more to offer. So I think that's why I find it so hard. And now, moving on several years to where I am now, as I've said, I don't feel as if the role I'm in is a job at all. I feel it's an honour. I feel it's a duty, the job I'm doing, because I do feel like, and again, unless you've been in the military, it's difficult to appreciate or understand, but it feels like I'm serving again, because I'm having that link with the military. I'm networking with people at a higher level than I used to. I'm a volunteer member of a committee, the Veterans, the VAPC, the Veteran Advisory and Pensions Committee. And this is a ministerially appointed position, which I'm proud to have received. And also having facilitating the trust to get the Employment Recognition Scheme Gold Award means I am networking at such higher level and mingling with people. You know, I've never thought that I would be walking into an officer's mess for lunch. You know, it still doesn't feel right to me being a senior rate, but that's what I'm doing now, and I'm having that contact and with the military, and it feels like I've never left. To be honest, I'm respected. I respect them because they know that, you know, although I don't have a crystal ball, I can't predict the future. The one thing I say to the military that I know for a fact is that if you live to this point, every single member of the military will become a veteran. So I encourage them to come forward, support me, help me to mould the service into the way they wanted for when they become a veteran, and get their involvement. And working with them again is an honour. You know, it's great to meet these men and women of the military that make a lot of sacrifices for us all. And I just felt that doing this role allows me to give something back, and also what the role is that I provide is the fact that some may see it as pastoral or welfare, which it is. But the main thing is, and the reaction to when I speak to the veterans, the reaction that I get mostly is tears when I simply say one thing. And that happened just yesterday when a RAF, former RAF pilot, his wife came to speak to me. And at the end of the conversation, I simply said, if you walk away from this discussion from my desk, if you don't take everything away that I've said, just take away one thing, just one, and just know that your husband and you and your family have not been forgotten and you're not alone. That is the one key message. And she burst into tears and cried and said, I've got to go. And away she went. And, you know, I had a lump in my throat as well, as you do, we're all human. But that's the main thing, that's the main part of my job, my role, is to make the military community aware, and especially those that are former, that they've not been forgotten, that, you know, you're not on your own. There are people out there to help and support you. You just have to ask for it. We're all proud. We're all stubborn sometimes. We all think that asking for help is a sign of weakness, when, you know, I know it's not. It takes a lot of courage to ask for help. I'm living, walking proof of that. So my role it's grown so much, and I'm grateful to the trust for allowing me to run with it, because I was the first in the country. I designed it, I created it. I had the Veterans Minister, Johnny Mercer's blessing, and with funding from the NHS and the Armed Forces Covenant Fund Trust, we put a programme together, and now there's about 27, 28 clones of myself, as Mr. Mercer would put it, across the country, and it's growing. I'm mentoring over 50 organisations and trusts currently who are either interested in my role in replicating it, or getting their Employment Recognition Scheme Award, whether it be bronze, silver or gold, of which I'm a mentor for them as well. So I'm a great ambassador for all things military, and I'm also the lead recruiter as well of the former military into the healthcare setting. So I do a lot of recruitment work. I'll go into the community, speak to GPs and encourage them to become veteran-friendly accredited GPs practices. So I don't I've sometimes been criticised to say, when do I find 5 minutes to breathe? But I do it because I enjoy it. It's not a job to me. It's a duty. And I think that's, being in that frame of mind helps me enjoy it more. And I can see on a day-to-day basis the impact I'm having. When you say to a veteran, you know, just want to let you know that your service hasn't been forgotten, and you know, you've got me, you know, I'm here. And I remember one chap that just took a hold of my hand, and he just started to cry, and he said, "You have no idea, son, what that means for me to hear you say that." And I said, "Oh, trust me, I do." And they had the biggest smile. And as I walked away, he just gave me a wave. No, that's why I do this job. That's it's worth its weight in gold, you know. And that's and also part of my role is to be that mediator, so that I want to make people's time in hospital as bearable. I'm not going to say comfortable or happy, because nobody wants to come to hospital. And I make it as comfortable and bearable as possible. And if there's any miscommunications, anything they don't understand, I can make time to sit with them and explain it, or go and get the right answer and come back to them. So I'm that point of contact, that mediator, and also there for awareness, give them information on where the help is, how to access it, should they wish it. So I do that role. And something that I've developed recently is a role where any person, any former military that's made end of life, I will go up and see them every single day, but more to give their family pastoral support and be there for them. And then I often get invited to go to the funeral on behalf of a representative of the trust, to show that, you know, the respect, and to be there as an ambassador and a representative of the trust, and to be there to support them on the day. And I've also purchased coffin flags. So on the day as well, as a sign of respect, if the loved one would have liked to have a coffin on the flag, then I'll go along with the flag and dress the coffin as a sign of respect on the day as well. So it's all these little things that I keep thinking up. Just, it's all respect. It's all about remembering the sacrifices that they've made, and all these little touches. We've always said in nursing that it's the little things that make the biggest difference. And you know, and that's what I thrive on. And I'll do whatever it takes. If it's within my remit to do, I'll do it. And it's all the cumulative effect of all the little things that we do that makes us who we are, and it makes us have such an impact on people's lives that we'll never really appreciate truly how much we affect people's lives. But in the job that I am currently doing and developing, I do, and it's very heartwarming, humbling, sometimes sad, but it's the right thing to do. The Florence Nightingale, she is inspirational. She's got an amazing legacy that she's left behind, and when you look into the life that she led and the how shall I say, the challenges that she faced, the pressures, yet she overcame them. She knew that what she was doing was right. And although, for example, the Crimean War, the military didn't want her and declined her service, she went out off her own back with a team out to Crimean, and, you know, created what we now know as, you know, the infection prevention team, if you like. And she was years ahead of anyone else, that very quickly correctly believed that, you know, the environment, the infection prevention, sanitizing, cleanliness, all of this had a key role in caring for those wounded in battle. And there are others that have faced diversity, like discrimination, whether that be racial or because they're female in a male world, being military at the time. Thankfully, that's all changing. But, we've got a lot to thank these women for the sacrifices they made in actually following their beliefs. If you believe in something strong enough and you follow it because you know it's the right thing to do, then it's I think we need more people in this world that do the right thing. Doesn't matter how uncomfortable it might be, how painful it might be. Personally speaking, I was in a crossroads, not knowing what to do when just prior to my breakdown, and I went to a lecture from an astronaut from the space station who said that, and I'll never forget this, and I use this daily, that there's only one thing in life that will define you as a person. Only one thing that will define you as a human being. It's not what you've done, it's what you do next. And that's what got me to think, well, okay, what do I want people to see me as? Do I want to be that person that sticks my head in the sand and just carries on and ignores things? Or do I want to be that person that, regardless of what the outcome might be, I can hold my head up high saying I've done the right thing and I've done what was needed? And that's the sort of person that I wanted to become, and I feel I am. And I think that's the sort of person, that's the legacy that Florence Nightingale has created. And she started all those years ago, that she became that person, that she wanted to hold her head up high, knowing that she's done the best she could and she's done the right thing, despite how people might think about her. She done the right thing, and that's been brought through nursing throughout the ages and is still extremely current today.